There's a silent disease out there, and it's affecting a huge chunk of the population. But what if we could finally see it, clearly, quickly, and without any pain? Well, today we're going to break down a major step forward in liver health that might just change everything. Okay, first things first, let's just wrap our heads around the scale of this thing. We're talking about nearly 100 million people in the US alone with fatty liver disease. That's almost 1 in 3 adults. I mean, it's just a staggering number, especially for a condition that most people don't even know they have. And that right there is the core of the problem, isn't it? You see, in its early stages, fatty liver disease doesn't really have symptoms. It's this silent epidemic, just hiding in plain sight. So the big question is, how do you get a clear look at what's going on inside someone's liver without, resorting to something drastic?
So to find that answer, we've got to understand the threat itself. What we're looking at here is a condition that progresses. It starts off quietly, but it can lead to some really devastating consequences down the road.
All right, so the official medical term is MASLD. That's basically an unhealthy buildup of fat in the liver, and it's often tied to things like obesity and type 2 diabetes. But the real danger, it's the progression, because if you don't catch it, MASLD can turn into something called MASH, and that's when the liver isn't just fatty anymore. Now it's inflamed and it's being actively damaged.
And this progression is absolutely key to understanding the disease. It goes from a healthy liver to a fatty liver, then it gets inflamed with MASH. But the real danger zone, the part that doctors are most concerned about, is something called fibrosis. That's scarring. And that scarring can lead to cirrhosis, which is severe, often irreversible damage. In fact, all the research shows that the amount of fibrosis is the single most important thing that predicts how a patient will do long term. Okay, so if figuring out how much fibrosis there is so critical, why has it been so darn hard to do? Well, that brings us right to the heart of the diagnostic dilemma that has been bugging doctors for years. For the longest time, the, quote-unquote gold standard was a liver biopsy. Yeah, but think about it. It's an invasive, painful procedure. It comes with real risks. And on top of all that, a biopsy only takes a tiny, tiny sample of the liver, so it's super prone to errors. So then you look at the other options, the non-invasive ones. An MRI, it's really accurate, for sure, but it's also incredibly expensive and just not available everywhere. And the older ultrasound tools, they're useful, but they can really struggle with accuracy, especially for patients who are obese. And this is exactly the gap that a new piece of technology is trying to fill. So let's meet the star of our show today, a device called VELACUR. So here it is. This is VELACUR. It's a portable ultrasound system, and it's designed to be used right there, at the point of care. I mean, just think about what that means. It takes this powerful diagnostic tool out of a specialized hospital setting and puts it right into your local doctor's office. That's a game changer. So how does this thing actually work? Well, it's a really cool combination of AI-guided software and a clever bit of physics. The device sends these super gentle, low-frequency sound waves through the liver. They're called shear waves. You can almost think of them like tiny ripples in a pond. And by measuring how fast those little ripples travel, the device can figure out the liver's stiffness, in other words, the fibrosis. And at the same time, by measuring how much the signal fades, it can tell you exactly how much fat is there. And what's it like for the patient? It's incredibly simple. You just lie down comfortably, they place a small vibration source under your back, that's what creates those shear waves, and then they do a totally painless scan right from the outside. The whole thing, it takes about 10 minutes, and you get the results right away. No needles, no pain, and no waiting around for answers. Pretty amazing. Okay, that all sounds fantastic in theory, right? But how does it actually perform in the real world? Because when you're talking about medical tech, the data is the only thing that really matters. So let's dive into a head-to-head comparison. All right, so there was this big clinical study. It was published in a journal called Hepatology Communications, and they did a direct comparison. They took a group of patients who were suspected of having fatty liver disease and scanned every single one of them with 3 different things: VELACUR, its main competitor, FibroScan, and then this super accurate, but again, very expensive MRI. The MRI was basically used as the benchmark, the ground truth. And the results? Honestly, they're fascinating. When it came to detecting liver stiffness, the fibrosis, both devices were great, pretty much statistically identical. But, and this is a big but, look at that second line, detecting liver fat. VELACUR scored a remarkable 0.94 for accuracy. FibroScan, 0.79. Now, that is a huge difference, statistically speaking. And it's so important because detecting that fat is the very first step to even diagnosing the disease in the first place.
Yeah, this chart really just spells it out, doesn't it? For that critical first step, just answering the simple question, does this patient have a fatty liver? This data shows VELACUR has a clear, significant leg up when it comes to accuracy. And hey, this isn't just my interpretation of the data. The study's own conclusion, remember, using MRI as the gold standard, was totally unambiguous. They said, and I'm quoting, VELACUR was superior for liver fat detection. Wow. I mean, a direct statement like that from a peer-reviewed study, that gives this technology some serious clinical authority. So, let's pull back for a second. What does all of this actually mean for the big picture? Because this isn't just about some cool new gadget. It's really about a fundamental shift in how we can approach liver care. First things first, this device is the real deal. It's credible, it's validated, it's received what's called 510(k) clearance from the FDA. That's a huge regulatory milestone that basically confirms it's safe and effective to be sold here in the US. And that's why the arrival of a tool like VELACUR couldn't be more timely. Seriously, we're at this pivotal moment where it's like a perfect storm for better diagnosis. Check this out. First, the FDA just approved the first ever treatment for MASH. Second, new medical guidelines are now recommending screening for at-risk patients. And now, third, we have a new tool that gives us the accurate data we need to find those patients and get them that new treatment. See? A perfect storm. So what this all boils down to? It means that for the first time ever, doctors can accurately find these patients, figure out what stage their disease is in, and monitor how they're doing, all during a regular office visit. This completely shifts the entire approach from just reacting to problems to actually getting out ahead of them. It's proactive care. Which really just leaves us with one final and pretty hopeful question. For decades, we've had this silent epidemic just growing and growing. But now, with these smarter diagnostic tools coming together with the very first wave of effective treatments, are we finally equipped to turn the tide on this thing?